In New Jersey, the homelessness crisis is rapidly intensifying, fueled by the destructive impact of fentanyl. Cities such as Newark and Jersey City are experiencing a steep rise in both homelessness and addiction, leaving many caught in a relentless cycle.
I was in foster care. I ran away multiple times. At the age of 17, I started smoking crack cocaine just to stay up in the streets, because I really didn't have a place to sleep. So I started doing that. In order to maintain my habit, I started prostituting.
And once full of promise, the streets now mirror the struggles of those confronting not only the absence of shelter, but also the tightening hold of substance abuse. This documentary explores the link between fentanyl addiction and homelessness, exposing the harsh realities that vulnerable individuals face. Join us as we reveal the truth in today's episode. There are shocking truths behind the scenes about the homeless in America that you won't expect.
I have really bad PTSD because my whole life I've been raped and abused and used, and I feel like that's a lot of our stories, but I have really bad flashbacks and nightmares, so when I get high, it kind of just stops everything.
The scale and characteristics of homelessness in New Jersey. New Jersey's homelessness crisis is a significant challenge affecting both busy urban centers and quiet rural counties. The 2025 NJ Counts report by Monarch Housing Associates shows that 13,748 people were homeless on a single night in January 2025, marking the highest total in more than 10 years. This includes a sharp increase in unsheltered individuals, those living on streets or in places not intended for habitation, doubling since 2022. Meanwhile, 85% of the homeless, or roughly 11,753 people, find temporary shelter in emergency shelters or transitional housing programs. These numbers highlight a growing problem driven by deep systemic issues. Families with children face a heavy burden, making up 36% of homeless households, with a notable rise since 2023. Alarmingly, nearly 1 in 4 homeless people is a child under 18, reflecting a generational impact. Chronic homelessness, where individuals remain without stable housing for years, continues to persist. Racial disparities are pronounced Black residents, though only 12% of the state's population are overrepresented among the homeless, along with Hispanic or Latino individuals. Many also contend with disabilities, including mental health conditions, and substance use disorders, emphasizing the link between health and housing instability. The crisis affects the state unevenly. Essex County, home to Newark, remains a hotspot, while Hudson County has experienced a significant increase. Atlantic County faces rising unsheltered homelessness, and rural areas such as Salem are seeing growing numbers, often without shelters or support services, rendering the crisis almost invisible. Why are rural communities usually seen as stable now facing housing insecurity? This question challenges our understanding of the homeless in America and calls for a deeper examination of the systemic inequities driving this crisis across New Jersey. If this issue resonates with you, like, share and subscribe to help raise awareness and foster dialogue about homelessness in New Jersey and beyond. The role of fentanyl in worsening homelessness in New Jersey. Fentanyl, a synthetic opioid 50 to 100 times stronger than morphine, has intensified New Jersey's homelessness crisis. According to the CDC in 2024, fentanyl was involved in 70% of overdose deaths in the state, affecting roughly 1,200 people. Among the homeless, the impact is severe. The 2025 NJ Counts report indicates that 30% of homeless individuals struggle with substance use disorders, with fentanyl being the leading drug in urban centers like Newark and Atlantic City. Emergency departments saw a 25% rise in fentanyl-related cases among the homeless from 2023 to 2024, a pattern that continues to climb. Fentanyl arrived in New Jersey through illegal drug networks in the early 2010s, often smuggled from overseas and mixed with heroin to reduce costs. Its low price and potency have made it widespread, reaching both urban areas and rural communities. For many homeless people, fentanyl use begins or worsens after losing housing, as the stress and isolation of street life drive them toward its numbing effect. Conversely, fentanyl addiction can cause job loss or family separation, pushing people into homelessness. In Newark, outreach workers report individuals surviving multiple overdoses, some up to 10, yet continuing to endure life on the streets. Witnessing this crisis is profoundly disturbing. Fentanyl's proliferation seems like an exploitation of society's most vulnerable profiting from their suffering. It is heartbreaking to see a drug destroy lives while support systems remain inadequate. Access to treatment is a significant barrier. Many programs have 3 to 6 month wait lists, and some require stable housing, leaving homeless individuals excluded. Shelters often turn away people using fentanyl for safety reasons, forcing them to remain in unsafe encampments. How can a system be built that genuinely supports recovery for those most in need? Efforts to combat fentanyl are expanding, but remain limited. The New Jersey Harm Reduction Coalition distributed Narcan reversing over 500 overdoses in 2024. Mobile units in Newark and Camden provide fentanyl test strips and clean supplies, but lack of funding restricts their impact. Training in overdose response increased 15% since 2023, yet the crisis continues to outpace these interventions. Fentanyl drives the growing population of homeless in America, calling for urgent, compassionate solutions to break this destructive cycle. Root causes driving the crisis. Beyond the immediate harm of a fentanyl, New Jersey's homelessness crisis stems from a complex web of structural failures that have worsened over decades. The most urgent problem is the severe shortage of affordable housing. The state is short between 214,475 and 224,531 affordable homes for extremely low-income households, with only 30 to 31 units available per 100 families in need. Rents have risen 6 to 6.2% annually, far exceeding income growth. A 2-bedroom apartment at fair market rates requires an annual income of $83,000 equal to 2.6 full-time minimum wage jobs. As a result, 44% of renting households spend more than 30% of their income on housing, and 22% spend over half, leaving them dangerously close to eviction. For these families, a single unexpected cost, medical bills, car repairs, or job loss can trigger homelessness. Evictions have surged since the end of COVID-19 moratoriums in January 2022. The NJ Counts report shows 12% of homeless households cited eviction as a main cause, while 14% faced soft evictions, such as being asked to leave shared housing. This instability is worsened by economic inequality. 11% of homeless people reported income loss, and 35.2% of homeless households have no income at all. Wages, especially in service and low-skilled jobs, have lagged behind inflation eroding financial security for many. Mental health and substance use disorders, though significant, are often wrongly viewed as primary causes. In fact, 46% of homeless individuals report disabilities, including mental health or substance use issues, which often develop or worsen due to the trauma of homelessness. The lack of accessible mental health care, long wait lists, underfunded clinics, and fragmented services leaves many without support. Similarly, the arrival of migrants and asylum seekers has added strain, though detailed 2025 data is limited. Cities like Newark face disproportionate pressure as federal coordination remains absent. Rural and suburban areas face distinct challenges. A 45% rise in homelessness over 3 years, particularly in counties like Salem, reflects the scarcity of shelters and services outside cities. These hidden homeless populations' families doubling up or living in cars often remain invisible to public awareness and policy. What does it mean when even the quiet corners of a state cannot provide refuge? This question highlights the widespread nature of the crisis, illustrating a broader failure to address the homeless in America. Government and community responses. New Jersey's attempts to address its homelessness crisis show a mix of ambitious initiatives and persistent obstacles, highlighting both successes and gaps. The state's Department of Community Affairs, DCA, operates the State Rental Assistance Program, SRA, accepting pre-applications through January 31, 2025 to provide housing subsidies. The Section 8 Housing Choice Voucher Program plans to issue 11,542 vouchers from 2025 to 2027, prioritizing at-risk and homeless households. The Comprehensive Eviction Defense and Diversion CEDD program provides free legal aid to tenants facing eviction, a key step in preventing homelessness. The Bringing Veterans Home initiative seeks to house more than 1,000 homeless veterans by 2027, targeting a particularly vulnerable group. The state passed Bill A4755 in 2023, enabling mental health services in emergency shelters, linking housing support with behavioral health care. The DCA also backs 16 continuum of care programs to enhance planning using data, helping counties coordinate more effectively. At the local level, Newark has made strides reducing unsheltered homelessness by 57% in 2023 through rapid rehousing and new affordable housing projects. Hudson County focuses on moving people from temporary shelters into permanent homes. However, smaller municipalities like Atlantic City and Millville have raised controversy by proposing bans on public sleeping or camping measures critics argue punish poverty. Non-profits play a vital role in filling gaps. Monarch Housing Associates leads NJ Counts collecting data and advocating for policy reform. Goodwill Rescue Mission in Newark offers meals, shelter and case management for homeless individuals. St. John's Soup Kitchen serves 300 to 500 meals daily while assisting people in securing subsidized housing. Yet, these programs often act as temporary relief rather than long-term solutions. New Jersey's safety net is extensive, but strained, struggling to meet rising demand. The state's dependence on emergency measures like funding hotel stays as shelters reflects a focus on short-term fixes rather than sustainable solutions. How can the system move from temporary support to measures that prevent homelessness before it occurs? The crisis of homeless in America, visible in New Jersey, requires more than reactive policies. It demands a framework that guarantees stability for everyone. Challenges and barriers to progress. Despite New Jersey's ongoing initiatives to combat homelessness, major obstacles remain that continue to hinder meaningful change. Proposed federal budget cuts to programs like Medicaid and SNAP's Supplemental Nutrition Assistance Program threaten access to essential healthcare for 350,000 residents and food support for 424,000 households. These reductions could worsen the financial pressures on many families, pushing more into instability and increasing the number of people at risk of homelessness. In cities such as Atlantic City and Millville, attempts to address homelessness through proposed bans on public sleeping or camping have raised serious concerns. These policies could fine or criminalize homeless individuals, making it harder for them to achieve the stability needed to secure housing. Instead of addressing the root causes of homelessness, such measures merely shift the problem and make life more difficult for those already suffering. Coordination among different levels of government remains a persistent challenge. Without a cohesive national strategy, local governments, particularly in cities like Newark, bear the burden alone. Rising migrant populations further strain limited resources, complicating efforts to provide shelter and services. Rural communities face unique challenges, with many lacking adequate shelters and support programs. Families in these areas are often forced to live in cars or overcrowded homes, their struggles largely invisible to the public. The fentanyl crisis intensifies these challenges, as many homeless individuals also contend with addiction. The overlap of these crises, addiction and homelessness, demands a comprehensive, multifaceted response. However, treatment centres and shelters are already overextended, with long wait lists and insufficient resources to meet growing demand. Public perception further complicates progress. In suburban and rural areas, homelessness is often hidden, reducing pressure on local leaders to act. In urban settings, stigma surrounding addiction and mental health continues to hinder the development of comprehensive solutions. Why do we allow a system that leaves thousands living unsheltered to persist, while political debates over funding drag on? This question challenges leaders and communities to reflect on their role in sustaining the crisis. These obstacles reflect a broader systemic failure. Budget cuts, criminalization, and a lack of coordinated policies leave many vulnerable individuals without necessary support. Addressing these barriers requires not only increased funding, but a change in perspective, one that views homelessness as a shared responsibility, not an isolated issue. New Jersey's struggle highlights the urgent need for unified action to create a clear path to stability for all residents and tackle the growing population of homeless in America. Potential solutions and a path forward. Addressing New Jersey's homelessness crisis requires bold, multi-layered approaches. First, the state must close the affordable housing shortfall by building over 200,000 low-cost units, focusing on extremely low-income households. Zoning reforms are essential to overcome local opposition and accelerate development. Programs like CEDD and SRAP should receive expanded funding to prevent evictions and stabilise renters. The Housing First approach, which prioritises stable housing before tackling addiction or mental health, has shown success in pilot programs and deserves wider implementation. Tackling the fentanyl crisis demands integrated strategies. Expanding treatment centres, removing housing requirements for admission, and scaling up Narcan distribution are critical steps. Mobile outreach teams carrying test strips and clean supplies should operate statewide, particularly in rural regions. Training for shelter staff and law enforcement in overdose response can save lives and build trust. Shifting from criminalising addiction to treating it as a public health issue is long overdue, as punitive approaches only perpetuate homelessness. Federal and state coordination must improve. A national plan to support migrants and asylum seekers would ease pressure on city shelters, while consistent funding for Medicaid and SNAP would strengthen economic stability. Addressing racial inequities is equally vital, with targeted interventions for Black and Hispanic communities disproportionately affected by homelessness. Public awareness campaigns highlighting homelessness in rural and suburban areas can mobilise support and resources. Community participation in efforts like NJ Counts can enhance data collection and service delivery. Through this documentary narrative, New Jersey's crisis reflects the broader reality of the homeless in America, urging a rethinking of safety nets as rights rather than privileges. Comprehensive solutions require investment, empathy, and political commitment. Without these, the numbers will continue to rise, and the dream of a home will remain out of reach for thousands. Conclusion. New Jersey's homelessness crisis, affecting 13,748 people in 2025, is a striking symptom of a broader national failure. The destructive impact of fentanyl, combined with unaffordable housing evictions and insufficient services, has pushed the state to its limits. Yet, within this challenge lies a chance to act decisively. By investing in affordable housing, expanding addiction treatment, and promoting coordinated policies, New Jersey can pave a path toward a future where homelessness is rare, brief, and non-recurring. This documentary calls on us to face hard truths. The homeless in America are not a problem to hide, but a community worthy of dignity and support. The question is no longer whether this crisis can be solved, but whether we have the collective will to try. We must choose action over indifference, ensuring every resident has a safe place to call home.